life threat that happens without warning and breaks peace of our daily life. Heart attack. Four minutes of golden time to save your precious life. We, Radian Heart Guardian, will save your valuable life. If you find an unconscious patient without breathing, first, tap patient's both shoulders and check for consciousness. If the patient is unconscious and not breathing, straightly lay the patient on flat and solid ground and call for emergency service team and ask for an AED. Then, kneel next to the patient's chest. Remove the shirt and bare the chest. Then put one hand over the other hand and clasp together, and place palm hand on half point of underside of the chest. Then, straight your elbows and to be vertical to ground, compress patient's chest in about 5 centimeters of depth using weight of your body. You must release your strength after compression so that the chest returns to its position. Repeat for 30 times in speed of 100 to 120 times a minute, twice in a second. Electric conductive metals, such as necklace, must be removed from the body, and if there are moisture on patient's body, it must be removed with towel. Next is mouth-to-mouth artificial respiration. First, push down patient's forehead with one hand and lift up the lower jaw of patient with the other hand, and keep the airway opened. Then, use thumb and forefinger of one hand to hold patient's nose, and give breath 2 times at interval of a second after completely covering patient's mouth with your lips. Check whether the chest is rising and avoid giving breath with too fast speed and heavy pressure. If artificial respiration is not suitable, chest compression is enough. CPR must not be stopped until rescue team arrives, and chest compression must not be stopped for more than 10 seconds. When AED arrives, one person should continue CPR, and the other person should use AED. First, open AED's cover and press power button on right side to turn on.
성인 모드입니다. 테이블은 그림과 같이 환자에게 부착하여 주십시오.
If the patient is a child, choose child mode to proceed.
어린이 모드입니다. 환자에게서 떨어지십시오. 심전도 분석 중입니다.
Adult mode refers to human age over 8 years old with weight over 25 kilograms. Child mode refers to human age below 7 years old with weight below 25 kilograms. Quickly open the electropads placed in AED folder cover. Remove protective film of electropads, then attach the pads on downside of right collarbone and below left armpit centerline as indicated on picture instruction. At this point, it does not matter the electropads are attached in different sequence as on picture instruction. After attaching the electropads, it automatically proceeds to voice guidance saying, ECG analyzing. And while analyzing, people near patient must stay away from patient, including yourself. Patient's body must be touched for accurate ECG analyze. After automatic ECG analyzing, if ventricular fibrillation is indicated on patient's heart, it automatically proceeds to charging, and when charging is over, press blinking orange shock button to provide electric shock according to voice instruction. Again, stay away from the patient before pressing the shock button. If you don't press the shock button, it repeats voice instruction for 5 times and cancels automatically. Repeat 5 sets of 30 times of chest compression and 2 times of artificial respiration. If artificial respiration is not suitable, conduct chest compression only. Check patient's breathing and consciousness after repeating 5 sets. AED automatically analyzes heart rhythm in every 2 minutes 30 seconds.
심전도 분석 중입니다.
Repeat CPR and electric shock according to voice instruction until consciousness of patient recovers or emergency service team arrives. If the patient recovers consciousness and breathing, stop CPR and press power for 2 seconds to turn off. Lay patient on patient's side in recovery posture. Now we will learn about pediatric CPR and AED use method. Pediatric here refers to child from 1-year-old to 7 years old. The difference between adult and child is depth of the chest. Compressing in depth of 4 to 5 centimeters is identical. But for an infant, we should place one hand on forehead of child to keep the airway open while compressing the chest with another hand. For pediatric, the electropads must be attached on the center of chest and back. The electropads can be used for both adult and child, and it can be used after changing into pediatric mode.
어린이 모드입니다. 환자에게서 떨어지십시오. 심전도 분석 중입니다.
We will now look at the real-life resuscitation case with the use of Radian Heart Guardian. The video you are looking at is the real-life situation happened at the badminton court in city of Ilsan in Korea. A man suddenly collapses. One of the badminton member then starts CPR, and another person brings AED for first aid. The patient recovered consciousness and breathing after 2 electric shocks. Then, sent to hospital right away, and now he is back to his daily life. A precious life has been saved thanks to Radian Heart Guardian. There was another real-life case in Gimpo Dongjin High School. One of the football club member had a sudden heart attack, and another precious life has been saved thanks to Radian Heart Guardian. As you can see, we are giving Heart Guardian awards to those heroes saved other people's lives with our Heart Guardian. Moreover, Radian's emergency medical technicians and first aid instructors are providing CPR and AED use method education in free so that our country's survival rate can reach to other advanced countries. Here is Radian Heart Guardian Use Guide. AED HR 503 series self-checks and self-inspects its function and status every day, and self-tests charge and discharge test once every month to make sure it will perform properly in emergency situations. Used battery and electropads can be easily replaced. Remove the pack by pulling up after pressing arrow point on battery installed at the back of the product. To install new battery, push to one side first and place it on flat area or knee, then use both thumbs to insert in until you can hear tap sound. For used pads, remove the connect wire from pad plug and insert new pads to pad plug in correct color. Then place the pad inside AED folder cover. Furthermore, you can check product's abnormalities through battery indicator. If product is suitable for use, it will indicate able to use. When it is not suitable for use, it will indicate unable to use. For products AS and component purchase, please contact 1670-1980. Fast and easy, usable, portable AED Heart Guardian. Your attention and courage may save a person's life.